Hello, and welcome to Psoriasis on YouTube. We cover all things psoriasis on this channel. Why does psoriasis aggravate more in the winter? Psoriasis is worse in the winter, but researchers are unsure of why. However, it's possible that both hereditary and environmental variables are involved. Inadequate sunlight. The absence of sunlight during the winter months may cause psoriasis in certain people. Sunlight contains UV rays, which can penetrate the skin and impede the formation of skin cells. Sunlight will probably benefit some people with psoriasis because UV light, in the form of phototherapy, is an effective treatment for the condition. An immunosuppressive effect from sun exposure has also been suggested by earlier research. Since psoriasis is an autoimmune disorder characterized by an overactive immune system, exposure to sunlight might aid with psoriasis symptoms. On the other hand, psoriasis may worsen in the winter due to a lack of sunlight. Furthermore, individuals with late-onset psoriasis who worked in occupations that exposed them to more sunlight during the fall and winter had less severe symptoms than those whose jobs did not expose them to as much sunlight, according to a 2021 study. Lower temperatures and humidity. Winters normally chilly and dry air might, in some people, cause a flare-up of psoriasis. Because the air is so dry, the moisture in the top layers of skin may be lost. In the winter, some people may also utilize heating systems inside their houses, which can also cause dry skin. A person may experience more severe psoriasis flares if their skin becomes dry. Therefore, maintaining skin moisture is crucial. Stress and illness. Psoriasis flare-ups can also be caused by stress and illness. Stress levels can vary throughout the year, and for some people, the winter months may be when they are at their highest. The winter months are when many infectious diseases are most prevalent. Although the cold doesn't make you sick, it can make you more susceptible to being sick with a virus, and some infections can cause some types of psoriasis, like guttate psoriasis. What parts of the body do flares affect? Psoriasis flares can occur anywhere on the body, but patches commonly form on the scalp, elbows, knees, palms, forearms, soles of the feet. Advice for treating winter psoriasis. People can manage their psoriasis during the winter by doing the following actions. Moisturizers. People with psoriasis need to keep their skin moisturized because the humidity is lower in the winter. After washing one's hands, taking a bath or shower, and before applying moisturizer, the American Academy of Dermatology Association, ADA, advises doing so. By doing this, you can help the skin retain moisture and lessen irritation and discoloration. To guarantee that moisture is sealed into the skin during the winter, it may be more advantageous to use heavier or thicker lotions and ointments. Humidifier. By keeping the skin moisturized, using a humidifier at home can help add moisture to the air and battle dry skin. Instead of taking long, hot showers, which can irritate and dry up the skin, people should take baths. The AAD recommends only one bath or shower a day for a person with psoriasis. Other tips include using warm water rather than hot water, limiting baths to 15 minutes and showers to 5 minutes, using a fragrance-free and moisture-rich soap or cleanser, washing the skin gently with the hand rather than mechanical tools, such as loofahs or washcloths, applying a fragrance-free moisturizer within 5 minutes of taking a shower or bath. Clothing. When it's chilly outside, one should try to stay warm by donning a hat, winter jacket, gloves, and waterproof boots. They should also make sure the clothing they are wearing is made of soft materials, such 100% cotton. These clothes won't subject the skin to as much mechanical stress as those made of abrasive materials, which could cause psoriasis. Hydration. During the winter, a person with psoriasis should drink more water to stay hydrated and prevent dry skin. Maintaining moisture is necessary to prevent impairment. Low humidity can affect the skin barrier function. Stress. Since stress can cause psoriasis flare-ups, a person should also make an effort to avoid or reduce stressful situations. Yoga and other relaxation exercises can be used by a person to manage their symptoms and combat stress. Treatment options. Psoriasis does not currently have a cure. However, there are treatments that can help control and lessen the effects of psoriasis symptoms. Topical medications. Topical therapies that are applied directly to the skin can aid in minimizing inflammation and discoloration. Inflammation may be decreased and the immune system may be mediated by these treatments. Topical steroids. These treatments contain steroids, such as corticosteroids. Corticosteroids are anti-inflammatory agents that help reduce inflammation, swelling, and discoloration. Topical nonsteroids. Nonsteroidal topicals contain active ingredients other than steroids. These can include vitamin D analogs, vitamin D derivatives, and anthralin. These ingredients may slow skin cell growth. Over-the-counter topicals. These topical treatments do not typically require a prescription, unlike topical steroids. The active ingredients usually include salicylic acid or coal tar. Salicylic acid helps with the softening and removal of scales, and coal tar can slow skin cell growth. Systemic treatments. Systemic treatments work by exerting their effect across the whole body. They are available as liquids, pills, injections, or infusions. Some systemic treatments for psoriasis include acitretin, cyclosporin, and methotrexate. Biologics are a type of systemic treatment that only targets specific immune cells or proteins of the immune system. Phototherapy. Phototherapy involves exposing the skin to artificial UVB, which can mimic the positive effects of sunlight on the skin. UVB can penetrate the skin and slow skin cell growth. In this way, it can help slow the formation of skin patches and reduce irritation and inflammation. At-home remedies. People can try additional tactics, such as include particular foods in their diet and engaging in regular exercise, in addition to trying to avoid probable triggers. When to consult a physician. If psoriasis symptoms continue to worsen during dry, chilly weather, people should speak with a doctor. A doctor can offer guidance if a patient's psoriasis has worsened since they were unable to control it during the winter. They might be able to recommend more potent medications in some circumstances. To summarize, psoriasis is an autoimmune condition that causes thick, scaly patches to form on the skin. Certain events, such as the winter months, can trigger a psoriasis flare. The low temperature, reduced humidity, and lack of sunlight can all contribute to the worsening of psoriasis symptoms. A person can try to manage their psoriasis symptoms in the winter by ensuring that they moisturize the skin regularly, take warm baths, wear appropriate clothing, and use a humidifier. They should contact a doctor if their psoriasis symptoms worsen or do not improve despite these actions. Thanks for watching. Be sure to like and subscribe.